Okay, this is a video discussing urethral slings for urinary incontinence. There's two types of urinary incontinence. There's stress incontinence, which happens when you cough or sneeze or you're working out and it puts that extra stress on the pelvic floor and you leak a little bit of urine out. It happens to a lot of women more than they want to admit, and especially those who have had children. We love those little guys, but they sure tear up your bodies. So this is an easy way to fix that problem. The other type of incontinence is urge incontinence. That has to do more with when you have the urge that you need to go to the bathroom and you don't quite make it there and you leak a little bit. That's a whole different subject that we can talk about later. Today I'm just focusing on the urethral sling. Most of the slings are made of mesh. There are three types of different urethral slings. There's a retropubic sling where they make an incision above your pubic bone and then they make an incision underneath your urethra and run this mesh sling through there. There is a transobturator sling and they make 3 incisions where they make 2 groin incisions and then the incision underneath your urethra. And then finally there's a single incision mid-urethral sling, which all it is just making that incision you have to make for the other slings, but you don't need any additional incisions. What's nice about that is there's less complications, less risk of infection because there's less incision sites, there's less risk of mesh erosion or excess mesh material, so it's the minimal amount of mesh material needed for this sling. The other 2 slings involve more mesh. It's just as effective as the other 2 slings because it's minimally invasive, and that's what I focus my practice on so that patients get better. That's the sling that I tend to use unless the patient has a specific reason for wanting the other ones. The procedure itself is very quick and painless. It's about 20 minutes. We do take you to the operating room and do this in a surgical center or in a hospital setting, but this procedure is very quick and easy. I use lidocaine type mixture or some sort of fluid like that to do what's called a hydrodissection, to dissect the vaginal mucosa away from the urethra underneath. And when I do that, it creates a space where we put that sling. The incision is so small I can't even put my pinky through the incision. And the nice thing about that hydrodissection and putting all that lidocaine or Marcaine or one of the numbing agents in there is when you wake up, you virtually have no pain. There's very minimal blood loss. During the procedure, I do a cystoscopy looking inside of the bladder and looking directly at the urethra where the sling's at. We don't want any tension on these slings, and so I actually do a pretty hefty dilation in the operating room when you're asleep to make sure that there's no tension on the sling. Occasionally afterwards, just because of the hydrodissection or the swelling, you might need to have a catheter overnight, but this is a very rare possibility after the procedure. 99% of my patients don't use any narcotics or anything afterwards, maybe a little bit of Tylenol or ibuprofen. You can have some spotting, which is normal, but overall, I don't put a ton of restrictions on you after the procedure because it's so minimally invasive, so you really can't mess things up by doing heavy exercise or things like that. The 3 things that I tell my female patients to stay away from for about 2 weeks after the procedure: 1, your husbands are going to kill me, but no intercourse for 2 to 4 weeks until the suture dissolves and everything's healed up. And number 2 is no bathtubs, pools. That is kind of a given with any surgery. The tissue gets too wet and soft and it'll tear through the sutures and then the incision will open up. Showering is okay, but any other soaking in water is recommended that you don't do that for 2 to 4 weeks after the procedure. And then finally, riding a bike, just because you're putting all the pressure on the seat right there where the incision is. Other than that, I've had patients go and run a 5K the next day. I've had patients do half marathons, things like that, just to try to show me, Dr. Henderson, that either the surgery worked or it didn't work. And majority of the patients, if not all of them, are very pleased with the results. It's so effective that I've had a handful of patients that might leak still after the procedure when their bladder is very full and when they're doing a very big exercise or have a big cough or a big sneeze. Other than that, it's that effective and it's life-changing. So I'm excited for you to get this done. If you need more information about the types of slings that we use and so on, we do have that information in my office, but it's a very good procedure, very minimal complications. Everybody always asks about mesh and they're scared about mesh. The mesh that everybody hears about in lawsuits in the news has been taken off the market. This type of mesh is still FDA approved. However, any type of mesh procedure, whether it's fixing a hernia or even this mesh urethral sling is something that you have to be aware of. I have had 1 or 2 patients where their body just doesn't like the mesh, so it rejects it. We go and remove that, we let things heal up, and then we do what's called an autologous sling, where we can use your own body fascia or some tensile tissue and use that as the sling. The reason that's not our go-to is there's more problems, complications, incisions with that compared to this teeny tiny little single incision mesh sling. And we watch for all of these things. We watch for infections and try to keep all those things controlled so that you have the best outcome possible.